I'm here again to spend this special moment with you, as I like doing this every week. How was your week? I hope you remained safe. We are continuing with our questions, our very numerous questions that you sent in, and we want you to keep sending in these questions. And the first question goes this way. My baby is 6 months old and has been passing stool with foams and also having cold. He was treated with cefuroxime, but it hasn't stopped. What do I do? Well, I would rather want to approach this question by telling you some of the things that you could do or what could be causing your child from passing this stool. First, you have to watch your meal. Could it be that you are currently on cow milk, or you are on chocolates, or you are on gassy foods, or you have spicy foods, or you are on caffeine? In other words, what you consume can actually affect the pattern of your baby's bowel movement. So you have to look at that. Instead of placing the child on medication, you could just adjust what you take. And it is also good you discuss this with your doctor who initially placed your baby on that medication. So question 2 says, hello doc, what could cause forced labor and how can it be stopped? At 7 months, she's already in labor and serious pains. Well, like we discussed when we talked about preterm contractions, we did identify infection as a cause. We identified hypertension or high blood pressure as a cause. High blood sugar could also be a cause. Hormonal imbalance could be a cause. So when you have preterm contractions, it is not usually the best for you to be at home. You go to the hospital and the doctors will be able to help you prolong the labor so that the baby does not come out too early. So we advise that you go straight to the hospital and you be attended to. Question number 3 is from Yinka. Yinka is asking this question from Ibadan. I wish to know more about hepatitis B positive patient who is not having symptoms, and can that patient undergo chemotherapy? Well, chemotherapy is not usually the first step for managing hepatitis B, even if the patient is in active phase. So since the person is not replicating or is inactive, you need not do anything. Maybe you just relax the liver by giving some supplement, but it is better to actually leave it alone. There is no need for that. Now, question number 4 says, can a woman of 40 years of age with multiple fibroids still conceive? The answer is no. But however, other factors has to be considered. Where are the locations of this fibroid they are talking about? Now, what is the hormonal stability of this woman? As a woman grows older, the ability to conceive actually reduces. So, but however, no singular factor can be attributed. You have to investigate and then come to a conclusion. Question number 5. What could be responsible for a woman to see her period again after her monthly cycle, especially when it comes with weakness of the body, pains on the left side of the rib, and swollen stomach? What also can be done? Okay. Well, the question is broad, but we'll try to narrow it down. 1, if the woman sees her period more than once, it could be, depend on the age of the woman, that the woman is heading towards menopause. Could it also be that the woman is on contraceptive and he forgot to take any of the contraceptive? It could also be that the woman is pregnant or is having a miscarriage. If the woman is already postmenopausal, that means the period has stopped or is going towards that. It is also necessary to rule out any form of cancer along the reproductive system. So bleeding in a woman that is not regular is something that should be investigated and should not be taken for granted. This is the next question. A woman has 2 children in her 30s. She is 45 and finding it difficult to conceive, though still seeing her period regularly. What can she do? We've made an attempt to answer this question. A woman at 45 years old, the ability to get pregnant reduces because the ovarian reserve is going down. The oocyte, the eggs, are not as healthy as they used to be, so conception may be difficult at this age. Hi doc, I'm Mercy and I'm 27 years old and have stayed up to a year and have not conceived yet. What do I do? The issue of infertility is not usually blamed on the woman alone. If you are not getting pregnant, could it also be that your husband is not producing healthy sperm cells to make you pregnant? So the need for you and your husband to go for investigation is very important here. So we do not want to say you are the fault or he is the fault. It's better that two of you find out why you are not getting pregnant. Hello doc, I gave birth through cesarean section in 2014, and since then I noticed that I have been having menstrual cloth and a sharp pain at the left side of my lower abdomen. I feel pain anytime my children hit me. Please, what type of test should I undergo, because I have been trying to get pregnant since then? This is Elizabeth from Lagos. You need to be investigated further. It may just be more than what you are seeing. That you are seeing clots shows that your bleeding is heavier than it should be. And lastly, at what month should a baby start sitting without support? At 4 months, a baby typically should be able to sit or hold its head, but it can extend even up to 5-6 months. So we hope your baby will sit as soon as possible. So that is how much we can take in this very episode. We hope to continue in our very next episode. Before then, I still remain Dr. Clement. I'm always interested in your health, and that is why we keep enlightening you. Keep safe.